So let's get started. In case you miss it, hello everybody. Thank you for joining me. I'm super excited to have the pleasure of providing some more clarity around the safe and sound protocol today. It is a clinical tool developed by Dr. Porgis. I am Ibrahim. I'll be your host, as you can imagine, and it's a pleasure to have all of you in my humble abode here today. So now that we've given people a little bit of time to connect already, we've had an opportunity to see where everybody's coming from, which I really appreciate. Thank you for engaging with the chat, guys. It makes it a lot easier when I'm not just talking to myself. I can go ahead and get started. I wanted to make sure that I kind of started us off with what we'll be going over today, just so you have a good idea of our agenda. So today we'll be covering safety in the nervous system, the SSP as a practical application of the polyvagal theory, and personally one of my favorite topics, the science of safety. After that, we'll be talking about the integration of the tool within a clinical setting. We'll be touching on the SSP's evidence for use within a clinical practice. And then at the very end, like I mentioned, we'll be doing a frequently asked questions section and a live Q&A as well. At the very end, on top of all of that, we'll be doing a draw at the very end for a qualified professional to be able to win a SSP training. So like I mentioned before, please stay till the end if you can. So just a little bit about me, wanted to give you a bit of a window into my journey and how it led me here to MyUnyte. So if you were hoping to learn about the safe and sound protocol, I have great news. You are definitely in the right place. As I mentioned, in case you missed it, I am Ibrahim, the mental health programs consultant at MyUnyte. Prior to my role here, I worked in the community mental health space for 8 years, supporting clients with a variety of mental health conditions. I started off initially within a recreational programming day service, where we created recreational therapy-based programs for individuals on the spectrum or neurodivergent pediatric populations. After that, I worked briefly in long-term adult inpatient setting for those with a developmental disorder. Shortly then after I graduated, I decided to go back to school where I went to Yale University to complete a substance use disorder postgraduate certificate in 2019 to 2020. And after I completed that, I practiced as a specialized residential counselor within a residential treatment center. Now, the reason that I'm so happy to discuss the SSP with all of you today is really from my own personal experience being absolutely blown away by this tool. It's nothing short of astounding how much a shift in the nervous system can be imparted by something as simple, really, as listening to filtered music. Personally, I did the SSP back in March, and I'm sure my wife would say the same thing, I'm a much better person for it. Now, I know for a fact that I can thank the SSP along with, of course, other modalities for that, but more specifically, the SSP has been an absolute game changer for my autonomic state, and really as a result of that, the way I engage with myself and those around me. So if I get a little overly animated, you'll have an idea where that enthusiasm comes from. So now that this stage has been sufficiently set, why don't we dive on in? I wanted to start us off with a brief clip that really kind of outlines the mission we strive to achieve here at MyUnyte. I believe that Dr. Porgis, our chief scientific advisor and author of the polyvagal theory, has really laid the foundation for everything we hope to accomplish here. And I really can't think of a better person to put to words how we aim to help our healing communities. So here is just a brief clip of Dr. Porgis, and please let me know in the chat if you guys are unable to hear the audio. I'll definitely adjust that for us.
So there is, when you use the term multidisciplinary, there's a common underlying core. And that is if we can feel safe, if we can convince our neurophysiology, our body, that we're safe, then the core of what it is to be a human can be expressed. But we live in a world, and I'm going to, in a sense, go into a little bit of a monologue script for a moment. But what we live in a world that is a heavily evaluative world. And we now have to translate what does evaluation do to our nervous system. We interpret it as threat. And everything in our world on almost a 24-hour, 7-day-a-week cycle is about evaluation or threat. And we need to, in a sense, understand that the only way that we mitigate or we downregulate those threat reactions, which affect mental health, obviously, but also affect our physiology. They create those so-called comorbidities, which are not comorbidities. What we've done is we've disrupted our neuroregulation of our autonomic nervous system. We have to respect the fact that through the evolutionary history of humanity, sociality was the way in which we downregulated threat. So our ability to interact with each other to detect cues of safety is not merely an option of a psychological domain. It's a neuromodulator. It's elevated to the level of changing our physiology. And those of you who use safe and sound protocol functionally have seen this work. It's in a sense using cues of safety along the acoustic channel to tell the nervous system that you're safe for a moment or safe for a while, and then what emerges. And what emerges is spontaneous interaction and self-healing.
Such a beautiful public speaker. I could listen to him talk all day long, but I digress. I'll move on forward here because I am the one who's doing the public speaking today.
So there is, when you use...
There we go. Sorry about that. So really, the purpose behind the Safe and Sound protocol and our mission here at MyUnyte is to really help our clients or your clients connect with themselves, others, and those around them from a place of physiological safety. The polyvagal theory, with which the SSP kind of is grounded, asserts that safety is everything. Without safety, there's no or extremely limited capacity for inter and intrapersonal engagement, expression, and connection. Now, that's great, but what does that mean from a practical standpoint? I mentioned it earlier, but I think it's important to restate it. Our core belief at MyUnyte is that the nervous system is the foundation of wellness. It is the base upon which our well-being is built, and one must be grounded in safety for progress to be made. Without that, like a tightrope walker without a safety net, the ability to move forward becomes extremely difficult or even impossible. Now, the chronic state of defense that your client's nervous system is in may be keeping them stuck in their protective patterns. Of course, this is not a conscious choice. Most individuals with a history of trauma, chronic stress, or even anxiety have developed this adaptive hypervigilance really as a means of self-protection. Now, that can be great initially, especially during those adverse experiences where these responses have really helped them overcome the adversity of their situation. However, the issue does arise when our nervous systems become chronically defensive and we're no longer able to kind of fluidly shift out of that fight or flight state, as well as the collapse state when we need to. A nervous system that's in a chronic state of defense has this almost limited or non-existent capacity for engagement, especially if all of its resources are being recruited for defense. Now, I do want to stop here for 1 second to provide a personal example regarding how this might look. So the personal experience that I had, and really the reason that I believe in the power of safety and the Safe and Sound protocol, is really my wife's experience. My wife is a nurse who at the height of the pandemic decided that she wanted to work in some of the most heavily affected COVID units. During her first assignment, she was witness to the impact really that COVID was having on patients, families, and coworkers. And she did find herself in this environment where the risk was unknown. There was limited protective equipment. And after 2 weeks, she had to leave her position because of the development of PTSD symptoms. When she came home, she struggled mightily with anxiety and would have days where leaving the bed was difficult. And I remember distinctly a couple times trying to make her favorite dish to try and cheer her up, but the anxiety in her body had her stomach so upset that she was not even interested in eating. I even remember times where I would do my best to talk with her so we could examine some of the ideas and thoughts that were feeding into those fear responses. But even me saying the word "let's talk" would send her into an absolute state of panic. Her nervous system was telling her that this conversational cue was unsafe, and as a result, it should not be something that we explore. The response, this bodily means of protection, had really been adaptive for her in helping her step away from the work that she was doing to protect herself, but it had become so entrenched in her body that it was now keeping her stuck. She sought out the support of an external counselor. However, progress was extremely slow and limited as a result of the body's chronic state of defense. We will return to my wife's journey shortly because I promise there is a happy ending to it. But first, I do want to provide a little bit more background to help bring us along. I want to state this outright because I do think it's absolutely paramount. It's extremely important. You cannot think your way to safety. Your body has to believe it. The nervous system is constantly processing information in our environment to determine whether it's safe or dangerous to engage. And this process, what Dr. Porgis has termed neuroception, is the unconscious detection of safety, danger, or life threat that our nervous system is scanning our environment for. Now, this is something that happens all the time, which I think is really interesting, below the level of cognition, really informing our brain and body if it is safe to engage with our environment, with others, and essentially the world around us. It all starts with the body itself, and more specifically, our nervous system. Safety is this physiological imperative that must be satisfied before we're able to open the capacity for engagement, as you can see, to really ascend into healthy communication processes, emotional processing, and then finally at the very top of our pyramid there, the ability to access executive functions, which would allow one to challenge and reform cognitive patterns that are maladaptive. That's really the reason why we emphasize this idea of starting from the bottom up. Now, when I was working with at-risk youth, often supporting clients with anxiety, mood disorders, and substance use disorders, a trend that I would often see within the clients that I worked with was this chronic defensiveness. I found myself often struggling to provide top-down support through talk therapy and behavioral management strategies initially. And that's essentially because I feel like they were completely encased in these psychological walls of hypervigilance, apathy, or maybe even complete detachment. And most of our session time was devoted to really dissolving those walls to be able to move forward. And that's when the idea of a physiological feedback loop of danger came to mind. So in a state of defense, the autonomic nervous system adaptively becomes biased to detecting and interpreting cues as dangerous. This can be the result of many things: trauma, relational or attachment rupture, chronic stress. Now, if I were to experience something as traumatic as my wife's experience, it's understandable that my nervous system would begin as a defensive technique or adaptive response to perceive all cues, even neutral ones in my environment, as dangerous. And this can last weeks, days, months, and even for some years. Now, this bias leads to a learned disuse of this social engagement system, really perpetuating the interpretation of stimuli, as dangerous. The social engagement system is essentially the part of our body that allows us to connect with ourselves, others, and those within it. It is innervated by the 10th cranial nerve, the vagus, which is really at the heart of the polyvagal theory and what the SSP is trying to influence. Now, that leads us then into this idea that interpreting cues as dangerous does limit our ability to connect, and as a result leaves us in a greater state of defense. Because we're in this defensive state, we continue with this negative cue appraisal, and around we go. We go all the way back into that first step. Now, this loop is very challenging to break because it is absolutely going to keep on feeding into itself unless it is broken or interrupted. So where does that take us? Well, if we hope to break that cycle, we need to find a way to intervene by offering input directly into the nervous system. Now, the safe and sound protocol, it is that input. It interrupts the physiological feedback loop we touched on earlier by providing distilled cues of safety directly into the nervous system, into the network, responsible for processing the human voice. The SSP specifically filtered music is detected by the nervous system below the level of cognition, and it essentially whispers to the brain and the body, you are safe. It interrupts that feedback loop of danger, really ushering the system into a state of physiological safety. And as a result of that, clients or individuals are more accessible, more willing to engage. Now that we've laid down this foundation, is where I'd like to take us back to the story I was sharing about my wife's experience during the pandemic, because as I mentioned and promised, there is a happy ending to that story. So where we left off with my wife was she was seeking out the support of an external mental health professional. However, her progress through therapy was heavily impacted by her nervous system's response. Progress was occurring, but slowly. Often much of her sessions were devoted to kind of down-regulating her nervous system to set the stage for a top-down approach. I then spoke to her about using the SSP with me as an adjunct tool to stabilize her, allowing therapeutic sessions to begin from that solid base of safety. Now, employing the SSP along with mindfulness and of course, the great work that the therapist was doing with her really served to accelerate her progress. She was able to sit for longer periods of time in the discomfort that once would have her body completely disengaged from therapy. She felt more present during her sessions, and I'll never forget how she described the impact. I think she might have been a better person to talk about the SSP than me almost. The way that she described it is that the SSP was fighting the fire in her body that accompanied the anxiety that she was experiencing. It made that fire in her body when it would light up whenever she would think about her time within those COVID units would make it extremely difficult to think clearly. Within the final 2 months of therapy, my wife made more progress than she had made the 4 months prior, and I'm happy to say that she's back working as a nurse once more. Now, I just wanted to share that story to shed a little bit of light on the impact that physiological safety can offer to the nervous system, but also the clients that you work with as well. Now, Dr. Porges' research describes how safety is this psychophysiological state that opens the channels for engagement, where cues of safety can help shift the nervous system out of those chronic states of defense and interrupt the feedback loop associated with those states, and really facilitate a client to enter this state of activation that's more social and interpersonal. This increases connection and in turn helps other therapies become more accessible and effective. When our entire autonomic nervous system is no longer being recruited for those self-preservation tactics, our body, our mind, our desire really to connect with others is amplified. You can almost think of safety as this prerequisite state for availability, which in turn acts as a scaffold for the wonderful work that a lot of you do with your clients. Imagine a client walking into your office having completed the SSP and in a state of availability. They're ready to connect with themselves within the desensitization phase of EMDR, or to challenge some of the cognitive patterns that are keeping them stuck during a CBT session. They're ready to connect with their parts if you're operating within IFS or an internal family systems paradigm. They're just willing to be open and vulnerable with you and are better able to put words to their experiences. Now that looks completely different from sessions. My pleasure. It's been a pleasure to share that and really kind of helps me conceptualize the impact of this tool. So thank you for those kind words. So imagine that kind of a client walking into your office in comparison to sessions that would be infinitely different from one where a client is walking in a state of shutdown. Maybe they're nervous and unable to hold eye contact, or they're stuck in this state of collapse and unwilling to connect because of the physiological barriers their body is experiencing. Now, there is a science to safety, and I hinted on it earlier. I'm a very big nerd about the polyvagal theory. I absolutely love Dr. Porgis's work, and to give you a hint, that is the science to safety. Now that we've laid the foundation for the why and the heartbeat of the SSP, I'd love to shift gears briefly to talk about the science upon which the SSP sits on, which is Dr. Porgis's theory. So historically, the autonomic nervous system, which is a system in the body responsible for regulating our physiology, has been thought of as a binary system consisting of two parts, the sympathetic and the parasympathetic nervous system branches. These are understood to be antagonistic, at least historically, so when one is on, the other is off. The sympathetic system, you can think of it almost like a gas pedal, if you will, turning the body on to respond to threats. Your pupils will dilate, blood rushes to our extremities, your heart rate increases, and blood flows into your muscle tissue to really mobilize you to run or fight. The parasympathetic system is the brakes, which essentially turns the body off to rest and recover, and is exactly the opposite response of the sympathetic system. More recently, however, through decades of research in neurophysiology and human evolution, the polyvagal theory asserts that humans rely on social behaviors to survive. And according to the theory, the parasympathetic nervous system itself actually has two branches, making it a three-part system. So guided by the ventral and dorsal divisions of the vagus nerve, which are those two branches of the parasympathetic nervous system, each have their own unique functions. So from the very bottom of our slide there, the dorsal vagus branch helps us survive by shutting down physiological functions like digestion in the presence of life threat. Excuse me. So what does that look like? I don't know if any of you have seen those really cute videos of goats running around and someone jumps out and scares them and they just collapse over. Well, that's not just to be cute, that's actually a defense mechanism. Now, more readily with some of your clients, what that might look like is someone that's zoned out or maybe completely dissociated from their experience. Moving up the hierarchy here in the polyvagal theory, the sympathetic system evolved to help us mobilize against threats that aren't necessarily completely life-threatening. So this is a classic flight or fight reaction. This might look like a client who's reactive, angers easily, or maybe is just fidgety. And then lastly, the most modern of our parasympathetic nervous system that evolved is the ventral vagus, the social engagement system, which supports structures essential for behaviors within that social realm. It innervates the eyes, the mouth, the ears, and also supports facial expressions, listening, as well as language. This might look like a client who is engaged, making eye contact and responding with just the right amount of energy. Now, we discussed some of that in the abstract, but I'd love to maybe make it a little bit clearer as well. So I have listed some of these features that might be indicative of clients within sympathetic as well as the dorsal vagal states. So you can see with the sympathetic being a fight or flight response, it'll look like clients that are hypervigilant. Maybe they have difficulty focusing. They have issues with sleep and relaxation. They might be hypertensive or have excessive muscle tension in the body and face. This is essentially the body's way of communicating its internal neurophysiological state, one that is not ready for connection. Alternatively, someone that's in that state of dorsal collapse might look like a client who's behaviorally muted. They may have may be present, but have this ambivalent, avoidant, and inability to connect tendency. They might be dissociated or forgetful. They may even have this experience of chronic pain or fatigue, depressed mood, and even suicidality. What about a client that's engaged? Well, in polyvagal terms, that would be somebody in the ventral vagal state. They're better able to retain eye contact. They can speak prosodically. They have pronounced facial expressions as well around the eyes and the mouth. And they're really better able to tap into some of the higher order functions that would be really important for states of connection. They're focused. They're better able to remember and recall experiences, and they can better tolerate some of the positive and negative affect associated with their experiences. They're in a state that's accessible for communication, collaboration, and connection. So all of these things, everything on the slide there you see, are vital for genuine connection with others. Now that brings us to a key question. How do we help people get there? So we have talked about it a few times, but I'd love to reiterate as well. You know, the safe and sound protocol is the input that can help usher clients into that state of physiological safety. The SSP interrupts the physiological feedback loop of danger by stimulating the neural networks associated with listening, using algorithmically filtered music focused on the frequency of the human voice. Through this mechanism, the SSP alters the way sounds are interpreted, ushering the nervous system out of those sympathetic or those dorsal collapse states and into a ventral vagal state. Now, this is extremely important here. That middle ear portal specifically acts as our way of flooding the nervous system with those distilled cues of safety I touched on, and that's really what's going to be downregulating the hypervigilant state of a client's nervous system. So how does the SSP work? I am very, very much a believer in pathways, so I just wanted to lay this out for you in this manner. Hopefully that'll help clarify it for you, keep the knowledge train on the track, so to speak. So really with the first step, we engage the ventral vagus nerve pathway through the neural network associated with processing safety using auditory stimuli. We're doing so under the level of cognition so that clients are able to, they don't necessarily have to actively think about being safe. It's just something that's happening for them in their body. Now, I think it's important to state this outright as well. The SSP is going to be playing algorithmically filtered vocal music. It is music that your clients, as well as yourself, might recognize. It's pop music, folk music. There's even a little bit of jazz thrown in there as well that has had specific frequencies of sound stripped away, as those frequencies can be associated with threat. The next step is using the SSP, we can shift the nervous system into that state of safety. The algorithm is in a specific way, like I mentioned, filtering out the high frequencies of sound that are typically associated with distress and anger, as well as the low frequencies of sound from the music, and the lower band of frequency is stripped away because that was associated with predator vocalizations evolutionarily. What we're left with is this middle range of frequencies that occupy the same envelope as a calm, regulated human voice, almost akin to parentese. And that's really what's going to be causing that state shift for our clients. Leading us to that final point, you'll be then able to administer therapy to a physiologically and psychologically available client. Now that's kind of a high level perspective on how the SSP would work within a clinical setting, but how is the SSP structured exactly? Well, now that we kind of understand how that is, the SSP works from a clinical perspective, I would love to dive into the nitty gritty of what the tool is comprised of. Now, before I dissect what you see on the screen there, I do want to mention that for each of the three pathways that comprise the safe and sound, they are all mirrored. They contain the same music, they are arranged in the exact same way, but what's going to be distinguishing them is the level of filtration using that algorithm I highlighted in the last slide. Now, in my previous life, I did work as a cook, so I like using food-related analogies, also because I love to eat, to help conceptualize how the SSP pathways work. I'll be kind of using a bit of an analogy that relates to food to help clarify things for us. So we can start with the SSP Connect as our first point to dissect. This pathway contains no filtration whatsoever. It does contain some minor modulation, but none of the high and low frequencies are stripped out of it. And this essentially means it is music that is meant to really allow your client to have this almost orientating experience. It allows them to get an idea of what does this sound like, what does this feel like, and it helps lay the foundation and context for safety to be established before they jump into the SSP core, which is that main primary intervention phase. You can almost think of the SSP Connect as an appetizer, if you will, for the nervous system, really warming it up for what's to come. Next, we're going to be using the SSP Core. This is the main state shifting pathway within the SSP. It has the highest level of filtration, and it's going to be exerting the most influence on the nervous system. This is the only part of the program that requires 5 total hours of exposure, usually occurring over several sessions. There's a few reasons for that, mainly through the algorithm. The way that it's applied to the music is on a bell curve. So yeah, something like that. And as a result, the algorithm progressively increases the level of filtration over the course of the SSP core and then tapers down at the very end. So for that reason, it's extremely important that a client completes the entire 5 hours. Now, this part of the program could be conceptualized as the meat and potatoes, the main course of the SSP, if you will. Now, moving on to the final phase of the SSP Balance. It is a pathway that is light to moderately filtered, meaning it can still function as a state shifter, of course, moving people from that sympathetic or dorsal state and into a ventral vagal state, but it can be used more often than the SSP core. It's a great tool to build on and maintain the vagal toning that would have occurred through the SSP core. Now you can think of this almost like a dessert course, if you will, within the same analogy, something that we like to do often outside of eating a meal. So who exactly administers the SSP? Well, a wide variety of professionals within various clinical settings are leveraging the SSP as part of their treatment plan with patients. They can be counselors, social workers, psychologists, psychiatrists, psychotherapists, nurse practitioners, working within a clinic to support their clients with anxiety, PTSD, trauma, ADD and ADHD, addiction, autism, and so many other disorders. The SSP pairs very well with modalities that they would typically employ as well within that space. EMDR, somatic experiencing, play therapy, body work, behavioral therapy, brain spotting, neurofeedback, IFS, all of those modalities pair very well with the SSP. It can even be administered by physical therapists, occupational therapists, and physicians, as well as many other healthcare professionals as part of an integrative approach to complement the great work they do in serving their clients with GI disorders, sensory processing disorders, and chronic pain. Really, the idea that I'm trying to hone in on here is that the SSP is a flexible tool. Another thing I also wanted to highlight is that it's not meant to be a standalone tool. It is meant to be an adjunct resource that operates alongside the great work that you as a professional are already doing with your clients. Now, from a practical perspective, how exactly is the SSP delivered? Well, for your clients, the experience is relatively straightforward. They'll be accessing the SSP through an app. It's available on a mobile device, so that's Android or Apple products, pretty much any device that can access the App Store, essentially. They would then need to plug in any over-the-ear headphones. Earbuds are not recommended. They use those over-the-ear headphones, they plug them into their device, and they have to make sure that they're not actively noise canceling. And once they're able to do that, they can just plug them into the device of their choice and begin listening to the SSP. Now, for you as the clinician, which is something that I'm trying to make sure that it's relatively clear, you'll be managing the client's access through a MyUnyte platform, which is essentially our portal platform for clinicians. You can think of this almost as, the hub for everything that is SSP, which we'll be taking a look at in a second here. So in the provider's MyUnyte platform, you'll find client management and insights, psychoeducational content for yourself, your colleagues, and even clients and their families. This is also where your professional certification courses live, as well as a variety of supplemental support services and resources. Why don't we take a tour real quick, shall we? Let me just pull this up. So boom, we have arrived at our dashboard. This is the MyUnyte provider platform here that you can see on your screen. So as I touched on, you'll be able to access your certifications within this section. As you can see, and rightfully so, I've completed my SSP and my focus training. We have a resource section here that's chock full of wonderful resources that you as a clinician can leverage to use with your clients, yourself, and like I mentioned, even other clinicians. So we have intake forms here that you can use for various populations to really get that baseline understanding of where your clients are at. We have a case consultation form. So if you find yourself working with a complex case and want some more dedicated support, this is something that is part of your access. So you can leverage that for individually tailored support with your clients. We have manuals that you can share with the clients you work with, whether they're adults or children, to really bring them on the journey so they understand the what, the why, and the how of the SSP. We have an assessment section with curated assessments that we suggest the use of as pre and post-test measures to really monitor how your clients are progressing over time as they use the SSP. Most of your section, however, will be spent within this client management section, where you can add a client really with the click of 3 buttons. You're just going to be putting in their first name, last name, and email, and we send an email to them that walks them through the entire process. So it's completely automated. It's not something you have to worry about. You would just hit the add client button, and they would receive that email invitation from us. And once your client has access and they begin using the SSP, you'll be able to actually open up their dashboard and see, once the session is finished, exactly how they're using the tool. So for example, here, let's go with this one. So you can see that my colleagues was using the SSP Core adult version. That's the dinner portion of the SSP. She was listening for 11 minutes and 14 seconds. She even paused once, and if there was a longer pause in regards to duration, you'd be able to see that and really be able to dig into that as a potential conversational piece for a follow-up. Maybe they went to the bathroom, or maybe something bubbled up in their system that you can kind of unpack with them the next time that you have them in clinic. So that's just a very, very brief view of the dashboard. I think it would be helpful to maybe jump in and do a bit of a case story to get a better understanding of how this might work. So let's meet Andrea. There's many ways to use the SSP, but for Andrea, who struggles with the effects of trauma and experience anxiety, severe panic attacks as well, her therapist, Jill, suggests trying the SSP as an adjunct therapy to help reacquaint her nervous system with safety. They begin with the SSP Connect to orient Andrea's nervous system to the music and the listening experience. Now, while Andrea listens, Jill practices co-regulating, whether it's breathing exercises or even the polyvagal ladder that maybe some of you are familiar with, to really provide additional cues of safety to Andrea. In addition, she provides psychoeducation around the nervous system to really make sure that she has an idea of how the nervous system and its regulation is important as part of the therapeutic journey. As Andrea goes through the SSP, she begins to respond well to the Connect. They both feel she's ready to move on to the next phase, the SSP Core. So Jill prescribes the SSP Core as a total of 5 hours of listening, broken up over a number of days and paced by Andrea's physiological response. As she listens to the SSP Core, Jill is alongside her, co-regulating using various techniques, whether it's breathing exercises or guided imagery, and observing Andrea's response, titrating the SSP exposure as necessary to really ensure that we're not overwhelming her nervous system with this input. As Andrea completes the SSP Core, she reports feeling significantly more calm, present, as well as connected. So now that Jill and Andrea both feel the SSP Core has had this positive impact on Andrea's overall well-being and has helped increase her progress through therapy, after a couple of weeks have elapsed, Jill offers Andrea the SSP Balance, which in my analogy was that dessert phase, as a resource that she can use to maintain the ventral vagal state established by that SSP Core. They listen to the first portion together just to make sure that Andrea's nervous system continues to respond well to the input. And once that is established, Andrea can now use the SSP Balance to continue her vagal toning in her everyday life without the direct support for every session with Jill. So of course, the SSP is an evidence-based tool, and I want to just quickly go over the randomized controlled trial data serving as evidence for its efficacy. Now, there is a lot on this slide. I totally understand if it's hard to read, but these studies are posted on our website, so if you ever wanted to review them, they're definitely there. But I just wanted to quickly highlight and summarize the results of the two randomized control trials involving the SSP Core specifically. So the research demonstrated significant improvements in hearing sensitivity, spontaneous speech, listening, and behavioral organization. And then in the second trial, we saw an improvement in hearing sensitivity issues, as well as, well, I guess it would be a reduction in hearing sensitivity issues, as well as an increase in emotional control. And we haven't stopped there. We would like to continue building out additional high quality studies on the Safe and Sound protocol, being used with a variety of illnesses and chronic disorders. So these can look like, these studies are being conducted in adults with trauma within an outpatient mental health setting, adolescents with Ehlers-Danlos syndrome that suffer from gastrointestinal symptoms, joint pain, incontinence. We're doing studies with adults that have a diagnosis of Parkinson's disease, looking at the impact on facial affect, vocal prosody, state regulation, and function in daily life. There's another study as well going on with adults that have a chronic back pain issue. And we also have a final study with Olympic athletes measuring the SSP's influence on cortisol, heart rate variability, and muscle tension. And all of these have promising preliminary results. So what does this mean for your practice? Well, providers that I've spoken with report that the SSP essentially opens up their clients and relaxes their defenses, which improves their accessibility. As a result, clients often experience quicker progress, becoming more engaged and devoted in therapy, which then ultimately the SSP helps to accelerate results and improve therapeutic outcomes as well. I've also heard from other clinicians that I work with that once integrated, the SSP becomes this essential part of a clinician's practice and approach. If there's one thing I'd like you to remember about today's webinar is that that therapy is more effective when a client is settled on a foundation of safety, which is exactly the aim of the Safe and Sound protocol. And just to build on what we discussed here are two testimonials from our providers, which can be summarized as accelerated and improved outcomes. So Heather McDuffie, a licensed clinical social worker, indicates that at this point, and because there's such a high need, I require that any new client be willing to take the SSP. That's because it makes the work quicker and easier, melting through avoidant protection and gaining experiential legs that otherwise are clinically arduous to establish. Anna Duvali, an occupational therapist, indicates that the SSP allows me to achieve results that would otherwise take 6 months or more in a regular therapeutic process. Now, if you're interested, how do you get started with the SSP? Well, the first step is pretty straightforward. You complete your certification and training. After that, you can then purchase a subscription. And then lastly, you can begin working with clients. Now, speaking of the training, the certification course is an online and on-demand course, the cost of which is $249 as a one-time fee. It's split into two parts, and other clinicians that I've spoken with have essentially said that they're able to complete it over the course of the weekend. It is taught by Deb Dana, Dr. Porgis, as well as members of our clinical advisory team. These are the members of our team, the clinical advisory team that is. They are all seasoned SSP providers within their respective designations, and they offer us clinical insights as well as provide additional support to our new SSP facilitators as they embark on their SSP journeys. Now, moving on to that second step, in regards to subscription models. One of the options that I love to highlight to our clients is the annual subscription. And the reason I highlight it is for twofold. As an economical offering, it is our best option. If you're comfortable, of course, with an upfront fee style. In addition to that, we're currently offering a polyvagal practice bundle promotion that surrounds it as well. So the subscription cost is $1,499 for the year, and it includes the SSP annual upfront subscription, which is the app, the provider dashboard. It includes the cost of training, so you would not need to pay that $249. And it also comes with these physical good add-ons. So the first one is a pair of over-the-ear MyUnyte headphones, actually similar to these guys right here, that you can use alongside your clients as they use the SSP. A copy of Dr. Porgis' latest book, The Polyvagal Safety, Attachment, Communication, and Self-Regulation, as well as an exclusive live book review and Q&A with Dr. Porgis that will be occurring in the new year. And lastly, it does come with a Buddha board, which is a perfect thing to use alongside the SSP as a meditative tool for personal, professional use, or even as a gift for anyone in your on your list. So just in time for the holiday season, essentially, we're adding a ton of value to the sub. So for that $1,499, you'll essentially be getting a value of over $1,800, and it will really equip you with everything you need to put the polyvagal theory into practice going into the new year. Now, if you feel that this option isn't quite right for you, we do have a couple more, and I urge you to visit our website to view those other offerings as well. So what's your next step here today? Well, if you're ready to move forward, like I mentioned, you're welcome to go to our website to review the polyvagal practice bundle as well as our other options. If you have any more questions, I personally would absolutely love to hear from you. I absolutely enjoy every conversation I have with clinicians about the Safe and Sound protocol. I'm extremely passionate about empowering clients and clinicians to utilize it. So if you do have any questions, I'd love to hear from you. I posted my email as well as my direct number there. So if you'd like a personalized consultation for absolutely free, please don't hesitate to contact me. And with that, we have concluded the presentation portion of our presentation today. Now, I would urge any and all of you, if you feel comfortable, to unmute yourself and ask any questions that you might have, or if you prefer, you're welcome to throw your questions into the chat, and I'll do my best to get to them before the conclusion of our session today. I believe we have 10 more minutes. So in that time as well, at the very end, we'll be making sure to do the SSP giveaway for the training to any of the qualified professionals that are still around at the very end. Perfect. I see we have my pleasure, Christine. Thank you so much for joining us. And how about I get started with us? Thank you for your kind words. Here with an initial question just to help kind of get things going. So I will get to your question in one moment, Cheryl. So, to answer how the SSP can fit into a practice, well, as we discussed, the SSP is meant to be this adjunct tool that operates in parallel to the approach that you identify as most beneficial for your clients. And it's not meant to be a standalone. So with that said, one of the things that I hear from a lot of our providers is it is an extremely flexible tool. So if, for example, you are operating within a cognitive behavioral therapy framework, you can use the SSP as part of your exposure therapy work, or maybe even as part of the relaxation training within imagery work, for example. Maybe you use EMDR as your primary modality. The SSP fits wonderfully within the preparation phase and can be used alongside the relaxation techniques like belly breathing that you might be teaching your client. If you're a licensed marriage family therapist, maybe you have both clients listening to the SSP as part of this partner drawing exercise. And, shout out to the OTs out there as well. You can definitely use this within an existing treatment plan without having to change anything about your approach. I mean, it works very well with sensory integration work, deep pressure exercises, fine motor skill development, and all of the above. So Cheryl is asking if anyone is using this with long COVID. There have been some anecdotal uses of the SSP to support healing within a long-term COVID patient, but we don't have any specific research within that arena. But if we go back to really the goal of the SSP, kind of shifting clients out of that state of fight or flight, and really COVID is something that would be quite the traumatic experience to the body. And if we're able to state shift the client out of that kind of stress response and into one that's more conducive to healing, there is a potential benefit there for sure. I see Anne is asking if the trainings need to be 5 consecutive days or spread over 5 sessions. It's a great question. The training is online and on demand, so it can be completed at your own self-directed pace, and you're able to do it whenever you have the time. Now, if you mentioned that question in relation to the SSP Core facilitation specifically, it is meant to be scheduled over the course of several weeks, not several days in a row. And in response to the second part of your question, whether the SSP is covered by insurance, there is certain situations where that's possible. It's primarily within flexible and health spending accounts through private insurance. But the short answer to that question would be no. We don't currently have a CPT code for the SSP. And I think that's a great question, actually. So thank you for asking that, Anne. And it actually relates to that first question. The SSP being meant to be directly integrated into your existing treatment plan means that it's something that can be utilized within the confines of your sessions to really bolster your work with your clients. So essentially, if you're able to bill for your session as a whole with the SSP as part of it, then technically, I guess you could bill for the use of the SSP. But as a standalone tool, you would not be able to do so now. Yes, so thank you for clarifying that. And yes, you would be correct. And if you would go back to, if you can remember the case story went over. So I talked about titrating the client's experience. Typically, on average, clients will be listening to the SSP Core, especially for about half an hour sessions, once, maybe twice a week over the course of several weeks. So it's not something that's really meant to be fit into a very tight time frame. You can definitely do that, but especially with clients that maybe have a more sensitive nervous system, that might be overstimulating for them and might actually have the opposite of effect, putting them into an overwhelmed state. And then just to fill the time here as well in our last 4 minutes, in case there's no other questions, we do, in response to that third question, does MyUnyte ILS offer ongoing support to providers? Yes, we do. We have 3 different levels that we like to support our clients through. I mean, we are not an organization that just says, hey, see you later after you purchase. It's really our goal and our intent to make sure that clinicians have the knowledge and the support they need to be successful using the SSP. So the first level of support we have is a provider map for referrals. Once you have access, you're able to optionally join our provider database so that you can get client referrals directly from us. The next level of support we offer clinicians is the client success team. Their entire role here at MyUnyte, and I think it's amazing that we do this, is to act as your go-to for basic clinical integration and technical support questions. And then lastly, I kind of touched on it during our little platform tour, is the clinical consultation program. So if you want more directed support for a complex case you're trying to navigate, we will pair you, after you fill out one of those forms, with one of our clinical advisory team members to provide that dedicated support to really ensure that you're able to optimize the use of the SSP with those more difficult cases. I see that Christine is asking, is using the DreamPad nightly effective with the SSP alongside it? You would be correct. I mean, they are definitely using slightly different mechanisms of action. The SSP is a little bit more robust in its influence on the vagus nerve and the nervous system as a whole. The DreamPad is a separate tool, one that is essentially a pillow with a vestibular or bone conduction transducer within it. So yes, having the SSP done as part of your therapy sessions, and if a client maybe needs additional support for the sleeping process, that you need help sleeping more restfully for a longer period of time, you can definitely pair that with the DreamPad for them to sleep on. Now, we do have 2 minutes left, so I think it might be helpful at this point to pick out one of our attendees here. So I have a random number generator that I'm going to be throwing up on the screen, or just putting up here, and it's going to be selecting one of our 14 attendees to win the training. Now, keep in mind the training is meant to be for a healthcare or regulated healthcare professional, as well as some very, very narrow exceptions as well, but just wanted to make sure that that was a clear stipulation. So I'm just gonna throw up my, and it looks like number 11 is the winner. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Russell Pizel. That is you are the winner of our training. So if you wouldn't mind sharing your email address with me, I can connect with you to provide you the next steps to really redeem that SSP training that you've just won. Congratulations, Russell. So with that, I would like to thank you all once more for coming and attending the webinar. I hope it was helpful, and I hope that you're able to walk away from this with a better understanding of the Safe and Sound protocol. And like I mentioned, if you guys have any questions at all, thank you very much, guys. You're more than welcome to reach out to me. I would love to connect with you to learn a little bit more about your clinical context, your unique clinical needs, as well as the patients you serve. And we can kind of have a more individually tailored discussion about how the SSP can work within your clinic. Thank you so much once more, guys. I hope you have a wonderful evening, and thank you so much for coming. Take care now. Bye.